Founded in 1988, World AIDS Day was the first ever international day for global health, putting human wellness on a spectrum. Every year, United Nations agencies, governments, and civil society come together to campaign around a specific theme related to HIV and AIDS. This year's theme is Equalized, signifying a growing call for actions to ensure greater access to medical services and solidarity for victims and HIV survivors. The director of National AIDS Secretary Usman Baji said NAS remains committed to stemming the growth of HIV and AIDS and combat the stigma on people living with the virus in the country.
As a country, we have made a commitment that by 2030, there will be no new cases of HIV and AIDS, no deaths caused by HIV and AIDS, and also no discrimination against people already living with HIV in the Gambia. Many have already concluded that we are already off track on this commitment, largely due to the inequalities that continue to hold us back in our national response to HIV and AIDS.
Mr. Baji also urged the government of the Gambia and its partners to continue promoting a policy environment for effective fight of HIV and AIDS. Dr. Mustafa Bitai, Director of Health Services, took the forum through the status of the virus in the Gambia.
As a country, we have made appreciable progress in the national response. For instance, we have sustained a low HIV prevalence, which is currently at 1.52%. We have also increased access to HIV and AIDS services throughout the country and introduced right policies, strategies, and standard models of care to help us accelerate implementation towards achieving the 1990 fast-track targets.
Global all efforts to end HIV and AIDS are spearheaded by UNAIDS, which released a report that unpacked the impact and gender inequalities faced by a key population demographics had on the national AIDS response. The UN resident coordinator, Madam Wakane, said inequalities will indeed slow progress toward ending HIV and AIDS.
This World Day, we are calling out in one voice to equalize. The Equalize slogan is a call to action, a call to adopt the proven practical actions that will help and end AIDS. More availability, accessibility, affordability, quality and suitability of services for HIV prevention, testing, and treatment.
Human rights issues, particularly centered on mitigating the stigma against people living with the virus, play a crucial role in national efforts to mobilize concerted actions and civil awareness engagement led by the National Human Rights Commission.
When persons living with HIV are reluctant to seek protection and treatment services due to the stigma and discrimination they face from society, or in some instances, stigma from service providers, they're being denied the right to health.
Rohijan Manjang, Minister of Environment and Climate Change, spoke on behalf of the government.
As a government, we are strongly reminded by this year's theme to take practical actions needed to address inequalities and help end AIDS in the Gambia. Government will therefore work closely with the different partners and stakeholders in the following. We're increasing the availability, quality, suitability of services for HIV prevention, treatment, and support to that, so that everyone is well served. That is, we want to make sure that we equalize the challenge. Reforming laws, policies, and practices to tackle the stigma and exclusion faced by people living with HIV and marginalized population, so that everyone is shown respect and is welcome.
According to NAS, more than 24,000 people live with HIV and AIDS in the Gambia, and only 51% of them are aware of their condition. More people refrain from getting tested for HIV due to possible stigma and discrimination in society. Reporting for Jatis News, I am Dada Chan.